Hi guys, how's the connection now?
Let us know.
Oh, I just saw Kirk sign on.
Oh, is he a tech guy?
Yes, he is.
Hey Kirk, help us out here.
How's the connection now, guys? Can you guys let me know?
What's it say?
Another person has joined.
Oh, someone just
Yeah.
Yeah. Can you guys let us know? Right now, okay. Alright. We'll continue for right now.
Okay.
We're rolling.
Okay, we'll keep rolling.
Coming and going. Uh-oh. So far, just one drop for a few seconds. It's coming and going again for certain people.
Well, let's just do it and then
Do the best we can.
do the best we can. Yeah. I don't
Okay.
think we can. We could end up watching. People could end up watching maybe on YouTube
Yes.
if we could.
Might have to do the YouTube. Yes.
Okay. That might be it.
That might be it. Yeah.
Okay, guys.
Okay. Okay, so we took a look at the adductors. She was pretty good at that. Okay, we did look at the hamstring. She was very good at that. But one of the important ones would be can she pass the internal rotation test? And here she's missing that was sometimes called the Fiberg's test. So here you can see she's missing that one. Let's measure that. Scoot up a little bit. So to measure this, you have to have their feet on the table, and you're measuring from the first metatarsal to the table. So it's not a measurement of the foot moving. Okay, it's a measurement of the hip moving. So you're going to go here, and you're going to measure from there to the table, and so that would be like 4 inches, and you want to get it down to 0 inches. Okay, and that would be a test of the muscles that are the deep lateral rotators, like the piriformis, the gemellis. So this would be a test for those muscles, the obturator. Okay, so let's go ahead and test here. And you can see on this side, from right there, it's about 4 inches too. So here 4 inches, so we want to get that down. So that would be the deep lateral rotators, but also the adductors sometimes won't allow the leg to turn in, and sometimes also the psoas won't allow it. So sometimes it's a test of also those muscles as well. So we want to get those to really turn with this for pelvic floor. We want to make sure that these really turn in. So those are important. Another important one is the gluteus maximus. Okay, so for that we're going to go to the opposite shoulder. So we're going to do we're going to knee to the opposite shoulder, and for this you want the leg to lay on the chest. So go ahead, come over this way. So you can see you want the leg to lay on the chest. So this is not in the really painful zone, but it's not laying on her chest. So it's see I'm pushing, but not pushing really hard. So the way we measure that is we measure from the superior patella, so from the kneecap to the chest. And so that's like here it's 8.5 inches, and we'd like to get it down to like 5 or 4, something like that. And then we'll go to the opposite one here. And so this is also a test for the ability of the psoas to shorten, as well as the gluteus maximus to lengthen. Okay, so here from the superior patella to the chest. Okay, so that's 9.5 inches. So it's a little tighter on that side. So, but if the knee is here, if I push towards this shoulder and the knee is here, the person's in excruciating pain. If it's here, it's a little bit dysfunctional, but usually the person is not in excruciating pain. But if they're over here, ooh, they're really bad pain. so she's probably out of the pain zone, but she could be a little bit more functional. So we're getting there. We're getting there. Okay. Mm-hmm. So we tested quite a few really important muscles. There's a few more to test, but those are quite good to start with. Okay, so let's go ahead and let's treat. I'll go with one of the really important ones, which would be the hamstrings and the adductors. So let's set up the table for laying sideways. We'll get a hold of those. So if you could turn to the side and sit up, and then we'll set it up for sideways. And we could use a little bit of our hot water bottles.
You want another one here?
Yeah. Great, thank you. Super. Okay,
Connection seems better. Thank you.
Okay, let's have you lay sideways, either side. The other way.
Oh, okay.
Because she's standing. Okay, if you could go ahead and put your shoulder in on the crevice. Okay, so this is the way I'd like to set up for legs working sideways. And let's take a look at the adductor. Now, after we found that she passed the test, but now we want to look in and see if the fibers that actually go up into the pelvic floor, if they're in good shape, okay? So we're going to take a look at them. So we actually go in and palpate all the muscles. So let's look at we're going to take a look at the adductor magnus, and particularly we would like to look at the adductors here. And we want to see if they also, we looked at their stretch, now let's see if they shorten. And you can see they're having a little bit trouble shortening. So what I do is I get my finger right, now it's the upper adductors that refer up into the pelvic floor, okay? They attach onto the ischial ramus, okay? And so these upper ones, but a lot of times we'll want to treat the whole adductor region, but frequently the main ones that cause the trouble are up high. So I got my finger right on those muscles, and I'm lifting. I can feel that they're going into like when I passively move them, they're going into contraction, and that's a bad habit. So you want them to just to be able to, so you know they're in good shape. If when you're moving them passively, they don't contract. So we're going to go ahead. A lot of times they contract really hard and they never let go. They just hold on really hard, don't let go. And then when you try to move them, they don't contract, or they contract and stay contracted. So you're looking, what's the dysfunction? Is it a shortening dysfunction? Is it a lengthening dysfunction? So right now I'm going to go ahead and treat it, and I'm going to see if I can improve it. So I found a little bit of dysfunction in here, and I'm see if I can improve it. So I'm going to go. So here's the ischial ramus, and we're going to move inferior to it. So here's the ischial ramus inferior, and also we're going to look at the semitendinosus and the semimembranosus right here. Now they attach right here onto the ischial ramus, and this is where they go, and I can feel that I have some taut bands right here, and then coming down here to this attachment at the pes anserinus right there. So we're going to take a look at the semitendinosus and membranosus, the hamstrings. Now remember, those hamstrings refer right here, and they get a real sore, painful feeling right here, about right here, and the adductors refer right into the bottom, into the whole pelvic floor. Okay, so let's take a look at treating both of them. So remember, the most important section of the adductors is this upper section. So we're going to start a few inches below the pelvis, right there. So we're going to feel the pelvis, the bottom of the pelvis, and go inferior. And let's come down here. Now I'm going to look, and I found a little taut band. Okay? Okay, so how does that feel, Stephanie?
I'm
Okay.
sure that's tender.
Now, they have found in research, and I think many of us women would agree, that when you get your different parts of your menstrual cycle, frequently you'll have a lot of muscle activation and pain. Now, if we treat all these muscles and fix them so that they're fully functional, then when you have your menstrual cycle, you won't be having nearly as much pain, or considerably less, or none. So here I'm going along, so I'm touching. So the way I'm treating is I'm touching, I'm feeling the skin, and I'm coming down, and looking, going towards, and I'm looking. Now I found a taut band. Do you feel that, Stephanie? Oh yes, Stephanie's noticing these taut bands. Okay, good. Okay, good. And so now I'm going to go a little bit more anterior, and I'm going to go in and up. Okay, so again, now, so we started about here. So now let's go a little higher now. So we'll go about right there. So let's go ahead. We're going to go posterior, so right by the the ischial tuberosity, or the sit bone. For all of us that don't know the ischial tuberosity, that's the bone that we sit on, the sit bone.
That we're supposed to sit on if we don't
Oh,
slouch.
the slouching people might not sit on those
They don't
bones.
sit on them.
Okay, so you're gonna just touch. You can feel the skin. Now you're gonna go down a little deeper. There, I found a band right there. Right, Stephanie? Yes. So you can feel it right there. And I'm going towards the ischial tuberosity and towards the ischial ramus, or towards the bottom of the pelvis. And I'm just holding it, breathing and relaxing, and waiting for her to relax a little bit. So I first touch it, I go in, and then I'm pressing, and then I'm looking for it to be a little softer before I finish treating her. How long do we hold it?
Till it releases.
Well, I usually I usually hold it for at least 2 breaths, sometimes 3, sometimes 4, and I may come back to a spot numerous times. So so I usually, there's so many areas to treat, I usually treat a few areas, and then when I've treated, suppose the spot didn't completely release right now, frequently what I'll do is come back to it again.
Sure.
And again, and then often after you've treated it the first time, you've pushed a little blood supply in, and you pushed out some of those painful chemicals. Mm-hmm. And then after a few minutes, it begins to release. So frequently it takes a few minutes, and so often I might come back to it once or twice and check it and treat it again. So so I can find some taut bands right here, Stephanie. She can feel them. Mm-hmm. So, you know, I'm taking my time a little bit here. So breathing and relaxing while I'm doing it. So coming a little bit more anterior here.
Stephanie's breathing and relaxing into it, correct?
Well, she's doing an excellent job.
Good.
She's not tensing up even a little bit.
Wonderful.
She's doing a really good job of relaxing as we're treating. So this is, again, a really important area. So we're going to come up a little higher now. So now I'm just going to show us a nice picture. Let's see if we could take a look at a nice picture. Oh, this is the upper body. Okay. That's not a good picture.
Not the one.
Not the one.
Not yet.
Okay, so we're going to take a look in the pelvis here. So here we're going to go. So here's the adductors here. Oh, I can't find the picture fast enough. Okay, so I'll pull a picture out in a minute.
Okay.
Okay, so I'll look in my book here. So here, oh, but we didn't.
Is our connection doing okay, guys?
So here,
We got it.
I wanted to just show how the hamstrings that we're treating right here, how they refer right into the pelvic floor, right there, right into the pelvic floor. Then we're treating also the adductors next to it, and it also refers into the pelvic floor. Oh, there it is. There's the book over here. So over here.
All right.
Here it is.
This part.
There it is. Okay. So here we're going to be treating. So we're coming up. So we're treating. This is the area that we're treating. So just below the pelvis right here, and see how it refers up. So we're going to coming in and we're treating these muscles here, but you see we're pressing in and
Much
up
better
towards.
connection. Okay.
Oh, great,
Thank you.
great. So we're treating, pressing here and up towards the bottom of the pelvis, the ischial ramus, and also the ischial tuberosity. Okay, so here we're going to do it here, right here. So we're going to come up a little higher. And one way of getting is good to do is get this knee a little out of the way, so you can get a little higher. So here we are. So now, we're going to feel the sit bone with our elbow, and we're going to come down and press up towards the sit bone or the ischial tuberosity, and then press in. And I feel the tension there. So usually what I do is I first touch the skin, then I come down, and then I press, and I can feel the tension. I stop as soon as I feel the taut bands filled with the painful chemicals, and then I relax and breathe, and then I lift up, and I move to the next spot. So we're going to be pressing in and pressing up towards. What do you notice there, Stephanie?
I noticed
Good, she notices it.
Yes.
So here we're right at the top of the pelvis, and this is I mean the bottom of the pelvis, the top of the thigh here, and we're going to go a little bit more lateral. So we're pressing in and up towards the pelvis. So if you look at my elbow, so I'm coming down, and then I'm angling up like this. So I'm coming down and angling up. So we find this is the best way to do it. Yeah. Now we're going to come a little bit more anterior, pressing down and up towards the pelvis. Okay, so we're going to give this a little bit of a massage. Now we want to see, is it better than we started? So when we started. So we're going to go ahead and we're going to see if it has full function. So we're going to go ahead. Yeah, it functions a little bit better. Yeah, oh, that's better right there. It feels different to you?
Yes.
Yeah. So what did it feel like before?
It like caused numbness going upward.
Okay, so get close to her. So when I lifted it up before, you felt like, go ahead.
It was numbness up in the pelvic area.
Yeah, so it was referring numbness up there, a little bit of numbness. So then after I just treated it now, how did it feel when I lifted it?
It feels a little bit better.
A little bit better.
Yes.
Good. So that's a start. That's a start.
Good.
Okay, so I'm going to take a look at it again here, so just to get a little bit better angle. So again, I'm going to grab the leg, and then I'm going to come right here onto the pelvic floor, and I'm going to look below the pelvic floor, and I'm going to look for dysfunctions here and see. And so I found a couple more, but it's about 25% better, So so that's the area that you'd like to treat to get rid of the pain, pelvic pain of all kinds, including after intercourse or after defecation or urination, things like that.
And does it help with the burning and
Yep,
the
burning,
urges?
the urgency, or even the fella? How about, I remember the fella that had when he was urinating, he ended up defecating.
Right.
This was like
All of this is going to help that.
1,000 times tighter than on Stephanie.
Okay.
It was so tight. It was incredible. But we just treated, in this case, I treated the whole adductor because the whole adductor was dysfunctional.
Are you using your shoulder primarily to lift the leg?
Let's see. My shoulder. Well, actually, I'm lifting.
You're using your whole body.
I'm using my legs.
You're using your legs
I'm using
more,
my
sure.
legs, yeah.
Yeah.
So I'm actually not using my, my arm is doing it.
It's there,
but I'm actually lifting.
The leverage is coming from the floor,
Yeah,
up from your
I'm
feet,
lifting
your
with my
legs.
feet,
Yeah.
But sometimes I might do something different, but that's what I was doing right there. Okay, so let's, remember I said sometimes
Thanks.
you get a really burning feeling from the gracilis muscle. You see how it attaches right here, and then at the pes anserinus, and it comes up here, attaches here at the pubis. So let's take a look at that. That often causes pulling at the pelvic floor and can cause a lot of pain and dysfunction. So let's take a look at that muscle. So it's attaching right here, so I can feel a little bit tautness there. Oh, she noticed. she's agreeing with me. So I'm just looking for taut band here. Okay, so I feel the taut band up here. Yeah, a little bit right here. So suppose someone said that they have a bladder infection, but they said, but it just happened a minute ago. I didn't have a bladder infection, but now, oh, it's burning, and my urethra, oh, it's terrible. I woke up, I'd never had it. It just, it's something that's often a sudden onset. It could be actually a muscle dysfunction. So what if you treated the muscle and it went away? Then, it was because of the muscle. Okay?
Yes.
So one idea would be to treat the muscles and see what happens, okay?
Right.
So let's go ahead, we'll treat the gracilis. So let's go ahead, and you see, so here, that's this attachment there. And it comes up here, so I just looked at the attachment with my elbow for a second. Let's come up a little higher. Let's look for those taut, so what do you think of that?
Yes, she notices that one.
Okay, so this right here. So I have some taut bands right here, but this could be getting rid of what you think. So it could be just a horrible bladder, what appears to be a bladder infection, and it's not. It's all it is the gracilis pulling, or possibly the adductors referring into the region, or the hamstrings referring. So the combination of those three are very common. So we're just coming up here. So I've got a little taut band there, right? Yeah. So I'm just sinking into it. So as she's relaxing, I go a little deeper. So what are we doing when we're so I'm just going to change my position here. When we find the taut band and we press on it, what's happening? We're pushing out those painful chemicals. So right here, that hard spot right there. So we're pushing the painful chemicals out of the tissue right there, and we lift up, the blood supply goes in. And so then the muscle's a lot more functional if you got a little blood supply into it. And we'll come up a little higher, right there. So that your gracilis attachments, and then we'll come all the way up, and we'll come up here all the way to its attachment on the pubis. Okay, so let's take a look. Let's see if it does a little bit better. Oh yeah.
Oh yes, definitely better.
So it wants to move a little bit more. Okay, so that's good. That's good. That's good. That's really good. Okay, so so that's how we would get rid of what appears to be a bladder infection, or sometimes if it's due to the muscles, if we have what if you go? Someone says they go to the gynecologist, and they put their feet in the stirrups, and they notice, whoa, I can't even get my legs apart. I've had people say that to me recently, and of course that can be due to these muscles that we just treated here. Often we want to treat the entire adductor, so it could be important to treat the whole thing. But remember, these are the ones that refer up, the gracilis. But it may be important to treat the whole adductor. We'll be doing that in the next few shows. We'll be treating the knee and the thigh, and are all coming up the hamstrings. So we'll be going over that in more detail. Okay, great. Let's take a look at the other side. Let's go ahead and turn over the other side. Okay, again, let's take a look. We're going to just take a look at. We did measure before, and she did really good on her test.
Do you want the pillow?
We'll get it in a second. That's good. I'll get it.
Okay.
Okay. So we're just going to do this other test, the shortening test. Okay. And you see, it doesn't want to do it. See, it's like it's resisting. So what does it feel like when I try to lift it? It feels stiff.
Stiff.
Okay.
Okay.
So a lot of people have this. It's like it feels stiff. It doesn't want to contract. So when every step you take, it's not contracting. You know, it's not doing its job. So this is an indicator that that's a dysfunction on the passive. When I passively move it, it goes into contraction. Okay. So we don't want that. So what we're going to do is we're going to take a look at the adductor on this side as well. So again, we're going to be concerned with these upper ones for the referral up, but often we want to treat all of the adductors. So let's go ahead and we'll treat the. We'll be thinking about that in the next few shows, but today we're going to treat the upper part and the gracilis here. So again, we're going to take a look, and we're going to look with our elbow now. So we're going to take a look here at the hamstring. Look at the hamstring, and here, yep, we feel a little taut bands right there. So we're going to treat that. So we're coming. Okay, well, not that hard. Okay, so I feel some taut bands right here.
Carried away in there.
Okay, we're going to press on it right here, and we're going to just hold it lightly because she noticed it.
Yes, she noticed it.
And then, so that would be remember these hamstrings that come up and then cause really bad pain here. So we're treating those first. Then we come a little bit more forward, and we're going to get right onto the adductor. So let's I feel some taut bands right there, don't you? Yes. Yeah. So first I'm just going to touch lightly. Then I'm going to come a little more. Then I go right to where I feel the taut bands. And what's in those taut bands is those painful chemicals. And we're pressing those painful chemicals out. And some of them would be, so you could say, would be substance P, substance pain, you know. And then there's tumor necrosis alpha. So there's lots of problems in there. Also, there's no ATP, no muscle, nothing for the muscle to eat. And so when we push in the blood supply, then there's plenty for the muscle to eat. Okay, so here we're going a little bit more anterior now. And I found some taut bands right there. And a little bit more anterior. And let's go back here again. So now we're going to get a little closer to the ischial tuberosity, or the sit bone. So the sit bone is right there. Okay, so that's the sit bone right here. And then the ischial ramuses are the bottom of the pelvis right in there. So here I'm going to get a little closer to the sit bone, or the ischial tuberosity. So here I'm pressing down, and I feel some taut bands right there, right? Yes. Okay, so she feels them, I feel them. So we're going to get in there, and we want to make sure the muscles have full ability to stretch and full ability to contract. Okay, now we're going to go a little bit more forward, or anterior. So I'm touching and coming down. What do you think of that spot? We notice that spot. So we're holding it, breathing and relaxing.
There's someone named Sourdough, and Sauer is spelt like your name.
Yes, that's probably somebody I know.
And somebody was asking if they were related to you, so we've got some conversations going on here.
They are related to me.
They are related to you.
Yeah, that's
okay.
No, that's my brother.
Oh, that's your brother.
Yeah, and he lives in Massachusetts.
Right, and he's in the other room on
That's
his,
it. That's
on
it.
his phone.
That's it. He's here.
Okay.
Mm-hmm.
He's sourdough. That's
He's sourdough.
Cute. That's
now,
cute.
his grandfather was a Austrian baker. And he came here around 1916 or 1918, around then.
Okay.
And then Kevin also became a really good baker as well.
Did he bring us anything?
Oh, not today.
Not today. Okay, we're gonna have to talk to him after we finish.
Okay, so now we're gonna go a little bit higher up. Now I'm gonna get my pillow.
Okay.
So I'm gonna get that up. Okay, the cameraman is doing
I can do it all.
Double duty.
I can do it all.
The camera lady's doing double duty. Okay, so now we're going to get, so again, here's the ischial tuberosity, and then here's the bottom of the pelvis here. So that's the ischial ramus. Okay, so here we're going to press down and up towards the ischial ramus. And now we're going to go a little bit anterior. So we can feel the bones. We're coming down and up towards the pelvis. Now, many times, wives have come in with their husbands, or husbands in with their wives, because of this pelvic floor issues and abdominal pain that's caused into the testicles or into the urethra. And the family is very, very upset when their other family members, have all this pain and dysfunction. Mm-hmm. And they're often very willing to help to treat them. So I often treat people's significant others and have them help.
And train them to treat.
Mm-hmm. And they do a good job. Yes. They're often very good. Yeah. And they're very concerned and very interested in helping. So it's very good to be able to help people and train them to help each other. Yeah. Okay, and a little bit more anterior. And then we're going to do our shortening test, and we'll do our lengthening test and see how we did so far. Okay? So again, we'll do the shortening test. So this is passive shortening. Yeah, moves better. Okay, mm-hmm. So what do you think? Yeah.
Yes, that looks better.
Yeah, much better. Okay, yeah, so remember, every step you're supposed to be able to use these muscles. And what happens is if I can't move them like that, then usually they're probably not working as well as they should when you're walking. The other muscle we were treating was the gracilis. So here it attaches here, and it comes anterior, and comes over here, attaches towards the pubis. So we're going to take a look at that again. So let's go ahead and let's look for some taut bands in that, and I can feel some taut bands in that.
She's laughing at
yes.
it. Okay.
Yeah, she notices it too. I
She
feel it right there.
notices it.
Yeah, she notices it. Yes. Okay, so here's its attachment. So let's go ahead. We'll just go ahead there and treat that a little bit. So I'm just going to feel the attachment. Then we're going to come up here above the knee. Remember, this one can cause you to have some fairly significant burning,
Urination burning?
urination burning, yeah. So, too painful? Moderately painful? Moderate, good. So I can often tell if it's painful or not because you can feel the person tightening up on you if it's too painful. So she feels very relaxed, very relaxed. And we're coming. So here we're coming a little bit anterior, forward. Oh yeah, right there. So I found some bands right there, and this is so the whole. In a way, this is less painful because look at. I'm using this whole region to press with, but when you're pressed with your finger, it's more pointed, you know. So in some ways, the elbow has some good, it's sort of more diffused. So it's less painful. Well, you tell me what you think, Stephanie.
It's making the upper part numb.
She notices
It's making the upper part numb.
She notices when we're treating here,
Okay.
she has, so, but do you think what do you think about the elbow treatment compared to the fingers?
Yeah, the elbow one is better than
Elbow is better.
Yeah, so
Less
just so
painful.
people, it's less painful because it's more broad. What you're treating with all of this, rather than just a pointed area. So frequently it could be nice, but more. Even though it seems like the elbow is a lot, it feels less painful because you're using a bigger, broader tool.
Right, and you don't have to lean in with all of your strength. You just
no.
give them some light
It could
pressure.
just be light. Yeah, of course. Yeah. So, and then of course you don't have to use your fingers and thumbs all the time, and which I find that so many of us are doing. Now she's lifting it much better.
Oh,
okay.
yes.
So that means that when she's walking, she wouldn't be causing referred pain into her pelvis. It's like she might have done before, but I didn't ask you. Did you ever have any problems like that?
Sometimes.
Okay, so she's had a few issues. So at any rate, we're nothing that she was bothered by enough to mention before, so it wasn't bothering her too much. But we found some things that we could correct. That was good. That's good. Okay, so let's go ahead and let's see how we do with our test. Let's go ahead. You lay on your back again. Let's look at our range of motion test. So I'm going to move your pillows. Okay, why don't you go ahead and lay on your back. So we didn't treat the gluteus, the medius or medius, but let's see. Well, this is a hair better. It's a hair better. Yeah, it's better. It's a little bit better. It's like an inch better. So that was from treating the adductors, and so that was good in the hamstrings. Yeah. So we improving a little bit. Now we'd like to get that to improve a little bit more. Okay. So it would be good to treat our abdominals and also our psoas and our gluteus muscles. So let's treat them. So I'm going to treat the gluteus muscles a little bit while we're stretching it. Okay. Okay. So we're going to go ahead and put it in this position, and while we're stretching it, we're going to press on it at the same time. So this is one way. So here's our greater trochanter, or our hip bone right here, and this is our attachments here in the pelvis. So here we're going to treat the gluteus. So what do you think of that?
I can feel that.
So we're right on it. So here's the hip bone, or and then we're going to come here. And then we're going to come a little bit. So each while we're doing it, we're seeing, does it improve in its range of motion while we're doing it? So the advantage of treating it while we're stretching it is that you can see if it's improving.
Right. You could see how much more it's
saying, when I treat
stretching.
that spot, it improves. we didn't take a break like we usually do.
Oh, we've been so into this.
Well, we took too many breaks with it already.
We took breaks trying to get our connection working.
That's right. Okay, so then we treated that a little on the stretcher. That was what I call a gluteus maximus minimus medius quick fix. and
Can you do this while they lay sideways?
Yeah, let's do the other one sideways.
Okay.
So this way we did this one stretched. Okay, so we did this one laying on her back stretched. So it was a quick fix. And let's take a look at the test right now. Oh, here it is. So on this leg, she was like about 4 inches, and now we're down to about 2.5. Yeah. So that's good. Let's do this leg. Let's check this one. And here, before we treated it, it's about, let's see. It doesn't want to go any further. Okay. And then that's about like we measured before. This is about a little bit over 4 inches, about 4 inches, a little bit more. So let's treat this one sideline. Okay. So let's have you just roll to the side and sit up for a second, and then you're going to turn this way. Okay, so why don't you go ahead, turn the other way. Just put your shoulder in the little crevice. Put your shoulders in here. Okay, so now we're going to treat the gluteus medius minimus here while we have them in this position. So here's our greater trochanter. Here's the top of the ilium. So we're going to be treating between from here, 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 like that. And then we'll do a little bit special on the gluteus max. So here's the minimus and medius right here. So we're going to find the greater trochanter. We're going to come in. So we're going to find the greater trochanter, come about come a couple fingers above.
Do you want her legs in this
This
position?
is good. Perfect.
Okay.
Yeah, that's fine. Yeah.
Okay, we'll just
So
show you
here-
how she has her legs. All right.
And you're going to push towards the greater trochanter. Now we're going to come a little in posterior, so feel it. Come away from it. Press in. So you're going to just touch first, then come down slowly till you feel the taut bands. Feel those taut bands? I got them right there. She agrees. Now we're going to push towards the greater trochanter. This is particularly for that pain in the pelvis, but also that comes down the outside of the leg as well. And then we're going to find the greater trochanter, press towards the pelvis, towards the greater trochanter. And give that a little bit of massage. Now we're going to come a little higher. So we're going to come straight. So again, look for some taut bands. I feel some right there. Okay. So I use my elbow to look for taut bands. So the elbow got smart. The elbow learned how to treat and evaluate and treat. The elbow learned a lot. Oh, now I found the spot. Okay, so I felt the skin. I went through the skin, a little bit of the superficial. Then I found some very tight spot right here. Yeah. Yeah. So as soon as I find the tight spot, I hold it, breathe, and relax. So and then I'm just waiting for a minute for it to get a little bit less tight. And she's waiting too. Relaxing and waiting. And now I'm going to lift up slowly. Now go a little bit posterior. Find the greater trochanter. Now we're coming up about 4 fingers. Coming in through here. Pressing in and towards the greater trochanter. Okay, now I'm going to press in. Now we're going to come a little higher. Now we're going to get the gluteus medius. So to get the gluteus medius, we want to press in and up towards the ilium. So let's feel the edge of the ilium with our elbow. Let's come down a few inches, an inch or so from it. We're going to press in and press up towards and capture the taut bands up against the ilium. We found some.
Yeah.
We did, yeah, we found some. So we're just going to hold it and breathe and relax. Again, so we're going to come a little bit more posterior, and then we're going to find the top of the pelvis, come a couple fingers below it. Maybe I'll go 3 fingers.
Do you have a pillow between her knees? Not right
No,
now.
no, I don't want a pillow between her knees.
Okay.
Why? Why don't I want a pillow between her knees? Who can tell me why? Okay, the reason why is because I want it to stretch. So if I put a pillow between the knees, it takes the stretch out. If you take the pillow, what if they had a lot of pain when I put it in this position? Then I'd put a pillow under their knee. But if they don't have a lot of pain, I'm trying to treat it on the stretch. I'm not trying to treat it in neutral. Okay, so here we're going to come and then up. Now this is the most likely trigger point that causes the low back pain, is be right here. So I'm going to find here and go up towards the ilium. Now let's take a look at the gluteus maximus here. So here, I'm going to really put the gluteus maximus on the stretch, okay? I'll give it a really good stretch, and then we're going to treat it right here. So let's go ahead and find...
Someone asked if it was the gluteus minimus.
We did that first. So let's do the minimus. So here's the minimus. So here's the greater trochanter. The minimus is right above it. So the trigger points for the minimus are right above the greater trochanter here. The medius, the trigger points are here. Okay. The gluteus max, the trigger points are more through this region here. So we'll look at all of them together again. But the gluteus max causes very significant pain in this area through here. So the way you might find it would be find the sit bone, and then we're going to work all around the sit bone. Find the tailbone, and we're going to work between the tailbone and the sit bone. This will get all the gluteus maximus points there.
It says glute medius is most likely to cause low back pain, question?
Yeah, it's of these muscles here. That's the one that causes. Let's look at the referred pain. Let's go ahead and look at it.
Okay.
Let's come over here and look at it so we can get it. So the gluteus medius is the most, it will cause low back pain. So here you see the trigger points at the top, really top, will cause this low back pain right here, okay? But it also causes pain in the middle here too as well, but it causes the pain in the low back. Let's look at the gluteus, the minimus. The gluteus minimus causes it more down the leg, but it causes it here into the pelvis, but down the leg. And see, it's more, so the trigger points are closer to the greater trochanter, whereas the gluteus medius, the trigger points are closer to the ilium, top of the ilium, and that causes more low back pain. Well, it depends on how you want to put it. You could say lumbar pain, okay? So even you could call depending on how you want to call what parts of the low back, So if you wanted to include the hamstrings, you could say the hamstrings also cause really good low back pain, but if the back comes all the way down here. So depends on where your back is.
How low does your back go?
Right. So here, let's take a look at the greater the ischial tuberosity. So we're going to come here and look for some taut bands around it. So we find some. I can find some right here. Yeah. There's some right here. So the taut bands stick out when you put the muscle on the stretch. Okay, I'm looking for taut bands that don't stretch. So when I put the muscle on the stretch, the ones that won't stretch are the ones we want to treat. So the advantage of treating on the stretch is that the taut bands stick out, and you can find them. And also, when you're treating them on the stretch, often the stretching increases. So then you know, oh, I fixed it. So if you can treat it while you're stretching it, you may find that you find the spot that's really causing the dysfunction. So here we're coming along the sacrum. And let's take it through range of motion. So let's stretch it, and let's put it down. Let's go ahead and stretch it. Okay, so let's see if we improved it. Okay, let's go ahead and lay on your back. Pull out our body support system. Okay, go ahead and lay on your back. So see which way fixed it faster. Okay, treating it while we're stretching it, or treating it on the side. Probably the other side worked pretty good. We'll see.
Take these water pillows.
Oh, we can take our water pillows. They're annoying us. Okay, we get those out. Okay. Okay, so here we go. So here we're going to turn again the way we're doing it, Alex, here. So we turn the foot in like this, and we're going to go ahead and we're going to measure. So here we're about 3.5 inches here. Let's go ahead and measure this one. This one here is oh, this is the one we treated on the stretch. It's down to 2 inches. So it was it could be that but it could be this one was worse to begin.
Yeah, that one was a little tighter.
Okay, so another area that we didn't treat was the abdominals and stuff. So
would you like to take a break?
Yeah. So why don't we take this time a 5-minute break?
Okay.
And then we'll do the psoas and the abdominals.
Okay.
And maybe the QL. Okay. All right. Take a tiny break. Okay. Okay. We're gonna take a little break, and so we'll take 5 minutes, and then once you take a little break, have some water, and we'll come on back and treat a few more muscles.
Can you see it pretty good, Kel?
801.
Yeah, nobody's complained about cutting out anymore. So.
Oh, that's so great.
Yay.
Put our music on. Okay, so you notice this one? Yeah. So it didn't want to work. This is, does it come along? Okay, so I think it's the psoas. Okay, so we'll do that next. So let's fill it up. So sit. We'll make you a meat sandwich, okay? Hi everyone, we're back. We're going to be taking a look at a few more muscles that cause some significant pain in the pelvic region, and we'll talk about a few of them. So here we go. I give the camera back to Camille. So we made a heat sandwich. We have a hot water bottle underneath her, and we got one on top. And this is always great. It's always great for the pelvis to have nice heat treatment like this.
And these are the Fomentech bags that you could get from Dwayne and Angie.
Right. Right. They're great. They're great. They're great. So one of the areas we like to treat is the abdominals and the psoas. So let's go ahead and put now sometimes I treat right through the hot water bottle. So sometimes I go right like this and treat. So especially if someone has a lot of pain and dysfunction, I might go right like this and treat right through the hot water bottle and treat the abdominals just like this. So here, it's a little harder to know exactly where you are, but it could be very important.
With Sharon's trained fingers, she could feel through cement.
So this could be a good way of helping someone. A lot of times I like to use the pincer technique on the abdominals. So let's go ahead and bend your knees. So we're going to treat the abdominals for a little bit. So here we're going to feel the abdominals. So we're going to feel, here's the ribs, and so this is where they attach, the upper attachment. And so here we're just going to pinch it a little bit and breathe and relax. And let's go ahead and go a little bit further down. Now it's the lower section below the belly button that bothers people on the pelvic floor. So here we are, the umbilicus right here. So from about here down is where we're going to see some pain and dysfunction. So this is our pincer technique. Now when we get right down to the pubis, we can go ahead and let's feel the pubis with our elbow, and let's go right there on the attachment of the abdominals. So the abdominals right there. Now this can cause really bad urethra or pain in the scrotum or in the balls, so it could really cause a lot of pain right here. So this area here is really important for the pelvic floor. So here you find the top of the pubis, you press in and then go down towards the pubis, but I'm not using very much pressure. How painful is it? Okay, it's not very painful. Okay, so here I'm at the other corner, so I'm pressing in and down towards the pubis. So if this was bothering, if this was very painful, you probably this would be one of her areas that, so if it was painful, then she'd have a lot of painful chemicals in there. Now another area that we'd like to go over is the inguinal ligament. So we'll go ahead from the pubis to the superior iliac spine interior. So we go ahead and press just right on that inguinal ligament. Before I did that, I was doing that with the hot water bottle.
Yeah, I think the hot water bottle is a little better.
So it was less painful, right? Yeah. So it's really important to make. Often it could be really important to make it less painful. We'll do that on the other side. So we'll show how we do it. So again, here's the pubis. So we're going from the iliac spine here, the interior, to the pubis, and we'll do it with the hot water bottle again. It's just for fun. So again, we'll feel the pubis, feel the anterior superior iliac spine. So let's go ahead and we'll press right onto it. So now, what do you think through the hot water?
With the hot water bottle, can you press harder in?
Okay, here we go.
Oh, she's asking for more pressure.
Yeah. So why is heat good? Because heat goes to the brain faster than the pain message. Why is cold good? Because cold goes to the brain faster than the pain message. So both of them go to so this is one of the things could help, is pressing in with the heat. Okay, so we took a look at some of the abdominals. Let's look at some of the oblique abdominals, okay? So let's take a look right here. Now remember, this one causes really significant pain right into the pelvic floor there. So it could go right in there. So here's the oblique abdominals, and let's take the ribs away from the hips here. And so we here, let's take a look right here. What do you think of that?
I can feel that.
Mm-hmm. So here we're looking for some taut bands. So we're using the pincer compression here. I'm coming over here. Okay, I find little taut bands right here. Yeah. So I look around for those taut bands. Okay, let's try it on the other side. Let's bend the knees again, both knees, yeah. Okay, let's go ahead, take this arm back. So get the rib cage away. So let's take a look at the,
Oh, look at that face.
Oh, dear.
Okay, she feels that one.
So I found some taut bands there. So it's pulling her ribs closer to her hip here. I can feel this.
Our thighs rotated to the opposite.
Well, I'm
Yes.
just trying to get the two parts further apart here. So yeah. So here we got the obliques. So I found some dysfunction in them. Pull them apart. So I've got the obliques. I'm going to pull them apart. Okay, so that we treat the abdominal obliques. Now let's take a look at the psoas. Okay, so I'm going to just go. So remember, you find the umbilicus, come a little bit lateral. And we're going to get underneath the abdominals and then down in here to the psoas. So that's the psoas right there. And then we're going to come down at an angle towards the ilium. So here we go. So I'm using my pointed fingers instead of my elbow. What do you think of that?
You feel it a little bit more.
Okay, so let's take a look on the other side. So remember, one of our tests is, can we bring the knee to our chest? It's like, oh, look, her leg is touching her chest now.
Oh.
So let's look at now this side here. I bet you it's not going to touch her chest. Okay, so here you can see. So you can see it doesn't want to come that way.
Mm-hmm.
Okay, so let's see. Let's treat this side and see how. So let's see how good we do. So we're going to come over here. So we're going to find the umbilicus. We're going to find the abdominals. We're going to come just underneath it and down, and we're going to look for some taut bands right there. So we found some taut bands, right, Stephanie?
Yes.
Mm-hmm. Right there. So we're right on the psoas, and we're going to come down a little bit more inferior here. And a little bit more inferior. And then I'm going to take a look at treating it in full range, and I'm going to take it a little bit and make it shorter, and I'm going to go deeper. So when you make it shorter, you can go deeper. When you put it on the stretch, you're treating more of the superficial. So here I'm going to go really deep. Okay, so let's go ahead and press your knee towards me. Push and relax. And push and relax. Good. So I'm just going to get on the other side. I know I'm making you move.
Okay.
Okay, so relax your leg. Let me hold on to it again. So what I want to do is get all those fibers in the iliacus here. So, okay, right there. So this is really, really important for the pelvic floor, because a lot of these nerves and muscles refer right down into the pelvic floor. So you can see we're getting closer and closer to her chest, showing that her glute max is flexible, and her hip flexors are flexing.
Mm-hmm.
Everything's flexing here. Okay, press towards that direction, and relax, and press. Good. Okay, so let's give it a little stretch. Okay, so let's go ahead and lay on your tummy. So this is the one way. So this is so we just treated this side. Now I'm going to stretch it. So I'm going to go ahead and have you press your leg towards the table. Push. Strong. That's how I get my weightlifting in. And relax.
At least she doesn't weigh too much.
Yes, exactly. Yes, good. Okay, press down again. Push. and then relax. Press down and relax. Good. And press and relax and press. Good. That's a good stretch. Okay, let's go ahead and lay on your back again.
Do you want to do the other leg?
Well, it was this one that I was
Oh,
fixing.
that's right.
Okay. The other one was doing good.
That's right. The other one had much
Yeah,
improvement
the other one was
already.
good. That was already good. Okay, so I was just going to check to see how good we did here. So let's go ahead. Okay, so it's turning in much better. Yeah. So we're doing, yeah, so we're coming down to, it's to about the 3 inches. Good, good. So let's do just a little bit more. So remember we treated this side here on the stretch, but we didn't treat this side on the stretch. So we'll do this side on the stretch. So frequently, here I'm going to use my thumb. Sharon's going to use her thumb.
That's a rare occasion here.
The iron thumb. So I'm treating it while I'm moving it. Okay? So this is a good way. And we're going to treat the tensor fasciolata.
Oh, how's your injured thumb? They wanted to know. That's the one she's using.
My thumbs are so strong. It's
She's
like
using both of them.
yeah, they're doing fine. This one, okay, so this one I smashed in the door, okay, in a car door.
Injury.
This one I dislocated, you know. So now they're both working. They're both working now. So this one's working perfectly. This one isn't working perfectly, but if I just treat it a little bit, I can get it to work perfectly. So there it starts to bend, and then often I treat the muscles, the long muscles that attach onto it. And so every day I give it a little treatment, but both of them are strong. Isn't that great?
Yes.
And this one dislocated and bent way back, and I had to have it sewn up. Okay, and
They remember.
and the second that it dislocated, I put it back in. And so it was I'm only dislocated for maybe a second or two, and then I put it right back in, and still healing, but it's doing very good. It's nice and strong. So good. I'm so happy. I have my thumbs. Okay, so here we go. So let's go ahead and have you resist and push your toe out, and then in. Let me take it in and push it out, and push it out. Good. Okay, great. Okay, so we treated a lot of the muscles, but we didn't treat the QL. So we'll just do a little bit of QL. So let's do that. Let's have you go roll to one side and then stand up. Okay, so go ahead and lay on your side. Okay, okay, so for this, we're going to treat the QL. So we want to make the ribs go away from the hip. So we're going to do a little bit of the oblique abdominals and the QL. So right here. So here's the QL. It's like a knife edge right here. Okay. So it's between there and there. So you want to get right on it. And when you put it on the stretch like this, it sticks out like this. Like you're pressing on this part of the muscle, goes all the way to the spine. You're pressing on this part of the muscle. So right there. Right on it. What do you think, Stephanie?
It's tight. A little bit.
Then I go forward and pull back on it.
And you have her leg off the table.
That's right. We're bringing the hip down and the rib cage up. Okay. Now we're getting behind it here. And again, we could treat all the abdominals. So we could look at the abdominals and look at the tightest part in the abdominals, which is right here. So this would be more superficial, and the other is deeper. Now let's go ahead. Then I'd like to take it off the stretch. So that's our QL. Remember, that can cause pretty good pain all the way into this region and back through here, so it could cause a lot of pain and dysfunction. So we treated a lot of, but it's also good for you to know how to treat yourself, right? So in addition to being able to we're going to treat ourselves, okay? We'll do it together. Okay, so let's see. Maybe I'll get you to do it too,
Okay.
and I'll see if Kevin would.
We'll let
show-
Kevin,
Kevin-
Mr. Sourdough. This is
Kevin, go ahead and
sourdough that you were asking about. Her brother Kevin.
Sourdough.
We'll let him do the video.
Okay, go ahead and see if you can videotape this part.
Oh, let's move these hot pants out.
Oh yeah, you can put them up here. That's great. Okay, so so here we're going to use some of these nice balls. We're going to use them on the floor. So this is they're called the 5-inch ball, and we get this from OPTP. This is called a fit ball, and this is 7-inch fit ball. So this is less painful, and this one's more painful. Okay, it's actually, these are more pointed. These smaller ones are more pointed, and the bigger ones are less pointed. So which one you try?
I'll try this one.
Okay. Okay, so we're going to get on the floor. So to treat some of the pelvic floor muscles, we want to get right on our sit bone. So what we could do is sit right on the floor and get right on your sit bone or right on your ischial tuberosity, and you're going to look around for trigger points. So you're going to look for tight, painful spots, and you're going to look around for trigger points right in your gluteus maximus, our gluteus minimus. So this here, we're getting more of our gluteus max, our deep.
Move over. I'm hitting the chair here.
So here, to get our gluteus minimus and medius, so you want to turn sideways like this and get right into the gluteus minimus and medius. So here, you could put this leg in front of you like that. So we're looking for, roll forward, look for taut bands, roll backwards, look for taut bands. What do you think? Can you find any?
Yes.
She found some. What about Camille?
Oh, yes.
So you look for your painful spot, then you're just going to go ahead and breathe and relax and press on. Now this is the more athletic way of treating it, okay? Okay, so that's our gluteus medius, minimus, and maximus. How would we treat our QL? Here, I'll take off my jacket for a minute. Make it a little easier to see. Okay, so our QL, we could come like this, and I'll put the ball above our waist and under our ribs, and this will get our oblique muscles that go right into the groin, and also our QL, which goes right into the groin. So we're looking for painful spots, and when you find a painful spot, you're going to hold it there, breathe, and relax. Okay, so that's a couple of them. How about if we're going to treat our psoas muscle? So for that, we would go ahead, lay sideways like this, come to our umbilicus, find our belly button. Then we're going to press right onto it and press just down to the amount that you feel a little bit painful, not too painful. And don't put all your weight onto it at first, unless you're prepared for it. Okay, then come down a little bit more inferior. You can catch all of these in the trigger point therapy for low back pain book, and you can get that on Amazon, like I said before, and you could just Google my name, Sharon Sauer, and the book comes up usually. And let's come up down here, and right where the inguinal ligament is, right where the leg bends, and press right onto it. So that's treating your psoas. Then let's think about our, you're getting very athletic over here. Okay, so what about treating our abdominals? So for that, often I have you come like this and get right above the pubic bone. So you can feel, so for this, you could get right above the pubic bone, right there like that, and that gets rid of a lot of that pain way, way down into the urethra or into the penis or into the testicles, things like that. So this gets right in there. And then you could come like this and go a little lower. The ball goes up. Treat it a little bit higher. Keep coming up here like that. So that would be a good way of treating our abdominals. How about our hamstrings? How can we treat our hamstrings? Well, since a lot of us are sitting all the time, this is the best way to get rid of hamstring troubles that refer up into the pelvic floor and the adductors. So what I'd like to do is have us sit down while we're treating ourselves. So I think what I'll do is I'll sit on the treatment table, and the rest of us, let's if you could sit on one of the hot water bottles. And I'm going to lower the treatment table down. So this is critical. If you're going to get rid of pelvic pain, you're going to have to treat the hamstrings. So one thing you could do is sit on your hot water bottle like I'm doing here, and then you could treat using your balls, right? So I have a variety of balls around, and these small balls can be really good because they're so small, they're easier to take around. Here's a golf ball, and these are super balls, so they're very good. And also, these are very good. Tennis balls, jackknobbers, novels, all these are all great to use. So do you guys have any balls over there?
Nope.
Okay, here's a nice ball, here's a nice ball, here's a little ball. You could use a couple of them. Okay, so here's your jackknobbers. Okay, there you go. Okay, so so what I'd like you to do is whenever you're seated, I'd like you to use some balls and get right on your hamstrings and just press right on your hamstrings with the ball, like that. You could treat both sides at the same time. Here I get two tennis balls and a knobble, all treating at the same time with the heat. So right now I'm treating the vastus lateralis here. Right here, getting a little bit of the vastus and a little bit of the, so we're getting a little bit of the vastus here and a little bit of the biceps femoris. So that's treating them. So you just breathe and relax, look for painful spots and hold them. And the heat's a little bit of a distraction, so that helps quite a bit. So then you're going to move them to another spot. So where's the main ones that cause pain in the pelvis? Is this one's on the inside, right? So let's go ahead and let's move our balls to the inside of our leg here. So let's go ahead and put them on the inside, right there, and put them on the inside. So we got them working on the inside, and you're looking around for painful spots to put them on. Now I find that this is just by treating, using the balls right where you're sitting in your chair, you can actually begin to get rid of a tremendous amount of pelvis pain. And then come up a little higher. And on this side a little higher.
On the top of water bag.
Yeah, the hot water bottle.
Question or comment?
Okay, the thing is, it's good not to put too much water in them, otherwise you float around. But they're still good. It's good to have a little bit of hot water, and it really makes a difference because heat sends a message to the brain faster than the pain message. It's good to, yeah, make sure to squeeze the air out of them.
At the top, like Tupperware.
Okay, let's come all the way high as we can, close to the pelvis, right near the sit bone. We're going to press right on it. And it's amazing how this gets rid of tightness in the pelvis. Yeah, you could take a look at Camille and Stephanie. Okay, so let's go, use the ball and let's go around the pubic, around the sit bone. Let's go around the sit bone and look for painful spots around the sit bone. So see if you find a nice painful spot. And this is, you're going to find a lot of these spots cause the pelvic floor pain. Especially if you find a painful spot. So move it around, all the way around your sit bone. Move around. Then, if I was in a conforming chair, I would then begin to put the balls like a car. If I was in a car seat, then I'd start to put them on the glute max here. I put them here for a minute, then I put them here. So I check all the glute max. I do over the sacrum. Come this way, Kevin, this way, so you can see. Yeah. So then I put them here on the sacrum, and I come up the back and treat through here using the balls like that. So that'd be if you were on a conforming chair, like a car seat or an airplane seat, something
Or
like that.
You could use one of these.
Or yeah, that's the
too.
next
This is
one. Yeah.
Right, the back
So-
cover there.
So this, then the next thing I'd like to use is this tool, and this is a great tool. I often use this, you know, in the car. So here you can put it like here. You can work. So this is deeper. This goes deeper than the balls, but it's really effective. And you could come in and work with this back knobber all over the gluteus maximus, everywhere. Look for painful spots here in the gluteus max. Look for painful spots here in the gluteus minimus and medius. So you'd be like this, pressing on it with your chair. So you guys over there, you can't see, but she's pressing. You know, she's got the tool. She's putting it on the chair, and you press your back onto the chair. So this is a great way to get the gluteus medius and minimus. Also, this is great to get your hamstrings, and to get the hamstrings. Now, what about our adductors, you guys? What are we going to do about our adductors? Okay, come this way now. So for our adductors, this is the best way. So I usually use the jack knobber like this, and sometimes I use my other leg to do the pushing, and I get right here on the right in the adductors, and we want to get high up for those ones that go into the pelvic floor. So you come like this, and you can come use the adductors and push again, you know, away and get in here so you can treat right high. This is one way. Then I come down and go a little bit lower. Look for painful spots. Come a little bit lower. Look for painful spots. So one hand is helping the other hand. Come a little bit lower. Look for those painful spots, and come all the way down here to this attachment here on the tibia. So the pes anserinus. So let's take a look at the hamstring. So the hamstring starts here, and then comes up here, comes here, and then comes all the way to the sit bone. So then of course you can come like this and give it a nice massage. Ways to treat the abdominals. You could use this tool for treating your abdominals as well. So you could come in like this, treating the abdominals. And there's, you know, also we could use the wall to treat ourselves. So so another tool that I like is this small balls, and I could take them around all the time. So if I'm somebody with some pelvic floor pain, I could just use these little small balls, and they're very effective too. But you can have them with you all the time because they're so small. You could use them, and also another way of treating these trigger points is on the wall. So let's take a look at me doing it on the wall for a second. So here, to get those gluteus trigger points, it's nice to really stretch it. Put your ball on the wall, and then you're going to go in here and really look for those taut bands. And oh, I found some right there. I found a taut band immediately because I put it on the stretch, and they're all there. I feel it right there. So you're looking around. You're going to go up and down, side to side. Oh, then you find all the taut bands, and you can do it right there. And also sometimes you can use these little tiny balls and get in there as well. And so you could really look between the sit bone and so you can go between the sit bone and the greater trochanter through here, and between the tailbone and between the sacrum, right in there. And you go with your little ball and look for really tight, painful spots. Press on them just like this. So this is a nice, really good way to treat it. Also, you can use this little one to come along the spine and treat this. Look for some super sensitive spinal segments along over the sacrum and along the spine. Look for those, and you're going to look for painful spots and in those areas, especially on the sacrum here. And when you find a painful spot, you're going to hold it, breathe, and relax. And then afterwards, we're going to move, right? We're going to move our pelvises.
We're going to move.
Okay, so let's go ahead and let's move our pelvises. So I'd like to, we're going to make our just a, not because I know. We're going to, okay, we're going a little bit over because we
had technical difficulties.
we had technical difficulties, so we're adding a few more minutes, okay? So gives us hopefully it won't be a problem for everyone, but we could always watch it later. Okay, so we're going to take a look at doing a little movement, but it'd be great if we could have maybe the Hawaiian music on. That's good. A bit louder. Yeah. Oh, good. Let's take that out. Okay, so we're going to move the pelvis. So we're going to put the pelvis forward, pelvis back, pelvis side, side, pelvis forward, pelvis back, pelvis side, side. Louder. Forward, back, side, side. Okay, so here we're going to do a little routine. Okay, you guys, we're going to do a little routine. Get a little routine going.
We're
Okay.
right behind you.
Okay, so here's our routine. We're going to go pelvis forward, 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 forward. 5, 6, 7, 8. To the side. 1, 2, 3, 4, 5, 6, 7, 8. To the other side. 1, 2, 3, 4, 5, 6, 7, 8. Now back. 1, 2, 3, 4, 5, 6, 7, 8, and all the way around. And the other way. Toes in. Toes out. Okay, 4 to the forward. 1, 2, 3, 4 to the side. 1, 2, 3, 4 to the back. 1, 2, 3, 4 to the side. 1, 2, 3, 4, and march. Toes in, toes out. Now 2 every direction. 1, 2 to the side. 1, 2 to the back. 1, 2 to the side. 1, 2 to the forward. And all the way around. And again the other way. Good. So march with your toes in and out. Stand like this in the ballet position. We do the hip twist. Look at your hip and down. Straighten, bend. Straighten and bend. Other side. Look, bend. Look, bend. Look, bend. Look. March. Legs out. And do the flat back. Your hands here. Stretch. Hamstrings and adductors. Middle. Hamstrings and adductors. Come up vertebrae by vertebrae. Bend, take it back. Hip flex and back. So let's take big steps. Big step. Big step. This is for your psoas. Big step. Big step. Big step. And march. Toes in. Toes out. Great. Okay, so let's put our theme song up. Okay, so I'm for all of you who are watching it on the rebroadcast, I'm glad that you're there, and I'm glad that everyone is sending hearts and enjoying our program. Next time, we're going to be, what's the next one we're doing, Stephanie?
We are doing the iliosacral pain.
Iliosacral pain. Okay. Okay. So do you have the one for that? Which muscles it is? That we had it out there a second ago. Sacral. So next time we're going to do these muscles. So next time we're going to do protocol 20, and we're going to treat the multifidus, the rotatories, longissimus, iliocostalis, the glute medius, the abdominals, and the soleus, because the soleus refers up to the pelvis, and even the soleus could possibly cause some pelvic floor problems. So that's important too. So these are the muscles we're going to treat next time. Oh, and the quadratus lumborum as well. So bone up on all those muscles, and that's what we do next time. And of course, the time after that. What are we doing the time after that, Stephanie?
We're doing lateral thigh and hip pain.
Lateral thigh. What's one after that?
Anterior thigh pain.
Next one.
Posterior thigh pain.
Next one.
Medial. Thigh
Louder.
pain.
Medial thigh pain.
Yes.
Yeah. So we got the thigh coming up. We're going to treat everything with the thigh. So those are all of our, that's going to help us with every kind of knee pain. So that's going to be great. Okay. Okay, see you guys next week, Tuesday, 6:30. Oh, invite all your friends.
Okay, now what are we gonna do? Sharon and Justin from Pain Free, who want you to remain free.
Your first shoulder.
We will assess and use heat, then compress and repeat. When a trigger point is there,
Okay, pelvis.
we'll
Forward.
teach you how to
Side.
do self-care.
Forward.
This will
Back.
keep you at your
Side.
peak.
Side.
So
Forward.
see you back again.